local foot soldiers, and I say the Republic of Efutu, when we all know by law there's one republic. Is this a matter that the presiding elder of the Pentecost Church, who has now been elevated to the status of minister of local government, and you know that I was part of the approval process. I was part of your approval process. Is it a matter for you to come and raise here? Mr. Speaker, what is a notorious fact is that in Efutu, all the assembly members are MPP members. Time is up. So we want you to plead with us. Yes. Then when you bring a good nominee, a good candidate, we are going to support you. But if you don't bring a good candidate, it will be difficult. But this is not about winning by the nation. It's a matter for the nation.
Honorable Minority Leader.
So, Mr. Speaker, they have to tolerate on this matter. Yes, I say so. That is true. Mr. Speaker, that
Honorable
is true.
Members,
all the assembly members are MPP members.
If you don't have the floor, resume your seat. Honorable members, sometimes out of respect to the leadership of the House, we normally don't rule them out of order. But if that is what the leadership is expecting from the chair, I will not hesitate to do so. I had the cause to admonish that the statement and the briefing made by the Honorable Speaker, the Honorable Minister responsible for health, is on cholera and meningitis, indicative of the fact that we are moving into matters not relevant to the issue at stake. What other indication can I give to a leader apart from what I have said? But when it happened, and that cue is not being taken from the guide being given by the chair, then we have to go strictly and apply the rules. In that case, the leadership must take it in good faith. Ordinarily, I was not going to recognize the minister responsible for local government, chieftaincy, and religious affairs, but his name has been mentioned multiple times. That is why I have decided to hear him. So, Honorable Minister, please conclude.
Thank you, Mr. Speaker. Mr. Speaker, in conclusion, I want to use this opportunity to also remind this very House that the disease we are all talking about has no political colors, and therefore it behoves on all of us to make sure that we take appropriate steps to help cure the disease. But, Mr. Speaker, it's only good to hear from the minister that the situation is improving, which means the minister and his ministry are on course. However, Mr. Speaker, there needs to be an interministerial and intersectoral approach, because in terms of sanitation, part of sanitation falls under the minister responsible for youth and minister responsible for youth, and part also falls on the minister responsible for local government. However, on the area of water, that also falls under the minister responsible for works and housing. So the four of us need to come together: the minister for health, the minister for local government, chieftaincy and religious affairs, the minister for works and housing, and the minister paid. In the budget to the sanitary inspector, that you are all calling for, made on this floor into contribution into approving the budget. By so doing, Mr. Speaker, we may be able to help together to build Mother Ghana. Thank you for the opportunity.
Thank you very much, Majority Leadership. Majority Leadership.
Thank you, Mr. Speaker, for the opportunity to add my voice to the statement.
Speaker, with your leave, the Honorable Minister for Rules wants to provide very quick information. Oh, why? What is wrong? I have been recognized by
Honorable Majority Whip.
Speaker.
Honorable
I am
Majority
seeking
Whip.
the leave of the Speaker. It is up to
Honorable
Speaker
Majority
to grant
Whip.
it or not to grant it.
Honorable Majority Whip.
Yes, Mr. Speaker.
If the leadership, the majority leadership wants to cede to the Minister for Roads and Transport, I would allow that.
Mr. Speaker, that is not my request. With all due respect, if you may hear me, he says he has an information to give to the House.
So,
please, Mr. Speaker,
Honorable Majority,
please sit down.
Honorable Majority Whip.
Please.
Honorable Majority Whip.
Why? What is wrong with you?
Honorable Majority Whip. Majority Whip.
Mr. Speaker,
will you listen for a minute?
I'm listening.
Yes. I know exactly what I am doing.
Very well.
I am engaging the minister in a negotiation.
Very well.
So I'm making a sign between him and myself.
Very well.
So therefore I know exactly what I am doing.
Very well, Mr.
So
Speaker.
Honorable Comfordoyo, you have the floor.
So I yield. Do sit down. Sit down. Please sit down. Sit down. Mr. Speaker, with all due respect, I give due regard to my brother on the other side. With all due respect, he should return the courtesy. With all due respect, Mr. Speaker, I thank you for the opportunity.
Honorable
Thank you, Mr. Speaker,
you have the floor.
for the opportunity to add my voice to the statement made by the Health Minister. Mr. Speaker, it's about time that we need to speak the truth to ourselves. Mr. Speaker, the whole statement is about cholera, and cholera this year it started from Adam. And when you want to understand what cholera means, which means somebody has eaten feces. Mr. Speaker, what brings about all those things is about sanitation. Whether we do proper sanitation. Mr. Speaker, just 2 months ago, there is a whole ministry for sanitation. And if you look at the budget for that ministry, and if you look at that budget and the sanitation doesn't go down to the people, then, Mr. Speaker, I beg to differ. We are not speaking truth to ourselves. Companies are paid for sanitation, but when you go to our villages, our other places, you can see that the containers are there and they are full, and nobody is taking care of it. Mr. Speaker, that money that we spend, especially the budget that we spend on sanitation, why don't we give it to the chiefs? And the chiefs will take care of the village and the environment. Because when you assign a chief to take care of his environment, and you pay him for that, and he has the people that will do it, they will make sure that there is the whole place will be neat. Just this Sunday, I visited a village called Kwalakoyom in my constituency. They have swept everywhere, every corner of the village is clean and neat. And if we can encourage them, Mr. Speaker, I think they will do proper work than what that telling our mothers and fathers that we have been educated and we will take care of them, we couldn't do. They will do it for themselves. Mr. Speaker, let's be honest. Eating feces is what revisit how we are managing sanitation. We have chiefs in every area. Even if we detail them alone, and government issue instructions that every chief should make sure his environment is clean, we will get a solution to this problem. So we shouldn't deceive ourselves and be beating around the bush as if we are working, but we are not working. Mr. Speaker, we need to sit down and do proper planning and work around these issues well, so that we will get the right results. Village by village, every electoral area, there is assemblyman. Work with your chief. At least a small budget for the chief. Instead of leaving the budget in the ministry, that budget should go there, and let's see whether we will not get results. They have a way of burning their refuse, and they can even use it for manure in their farms. So, Mr. Speaker, the way we started it and it's not working, let's change the style now and use our traditional council, our chiefs, assembly members, and then unit committee. We have unit committee members, we are not using them because of we are not giving them small allowance to go about and work in the place in their villages. Mr. Speaker, let's use the unit committee, the assembly members, the chiefs, so that those budgets should go to them. And let's see whether we will not get the proper results. Thank you, Mr. Speaker, for the opportunity.
Thank you. Before giving the floor to the Honorable Minister to wind up, I recognize Honorable Kwame Agboja on point of information.
Mr. Speaker, I thank you for the opportunity. I am not making a contribution to the statement, though I must commend the minister and the colleagues who contributed. Mr. Speaker, in this House, we have different people with different backgrounds. In this chamber, my hospitals are facilities with beds 60 to 120. When it gets to 120 to 400, it's a regional hospital. The fact that you can fit 100 beds into this chamber doesn't make it a district hospital. So it is important that when we are making interventions, and indeed, Mr. Speaker, the interventions of the minority leader in terms of provision of healthcare facilities is known, and colleagues have done that. But, for instance, to build a district hospital, even for 60 beds, you are getting close to almost $19 million. And it comes with 20 different departments. So when you are speaking in Parliament to make this statement and we let it go, somebody will hear that MPs are capable of building district hospitals. Why is the other MP not be able to build it? So it's important we make this. So my point is that if it will be good if the health minister, who is one of us, can one day take the opportunity to come and read out to us what are the standards of a cheap compound, a health facility, a polyclinic, a district hospital and a regional hospital. It will guide us. So when we are making the interventions, we just don't say that I build a space that can take 100 beds, so I build a district hospital. Because it's not as simple as that. That is all the information I wanted to provide.
Thank you. Thank you very much. Honorable Minority Leader.
Yeah, Mr. Speaker. Mr. Speaker. I thank you for the opportunity. Mr. Speaker, let me thank Honorable Kwame Agboja for his intervention and putting the matter in the professional perspective. I don't just speak. That children's hospital, I wish you get the opportunity to visit. It was properly designed by a professional architect. Professionals are involved in the construction. It has all the departments to make it a secondary referral facility. You need to see with your eyes. Don't worry. You need to, Honorable Agboja, who also doubles as an architect. I would want to have an hour ride with you to Winneba. Winneba is just 45 minutes drive from Accra. No, at least we'll get a dispatch. He has a dispatch rider. So we can take 45 minutes. Don't worry, you don't have a dispatch rider. It's okay. I have one. We'll go with mine. Mr. Speaker, 45 minutes, you can go and see for yourself what is happening at Jane Jazzy in Winneba. Mr. Speaker, I am not making a submission on the House floor out of ignorance. The professionals have indeed determined the capacity of the facility. It is not just a primary facility, it is a secondary facility. So, Mr. Speaker, I know what I am saying, that it is a 150-bed children's hospital, and it is coming from the professionals. So, Mr. Speaker, I think that clarification has to be emphasized so that he knows that indeed it is not just a district facility that I'm referring to. If it were to be a healthcare center, I would say that it's a healthcare center or a CHIPS. It is not. And it is not.
Honorable Majority Leader, he is a minority leader. He is raising a second part of the problem, which poses danger to all of us. Probably you have the means. Maybe you are a deputy leader, you became a leader. Therefore, what you can do, even most of the people at your back
Mr. Speaker,
may not be able to do it. When the public begin to measure us.
Mr. Speaker, I keep saying that the precedents we are setting, let's be guided. He got up on a point of information. He said, and you granted him that special leave. As to an intervention by a member in his constituency, it is his bona fide. We know that as a fact. So it depends on your constituency and the things that you would want to do and the personal effort. We all know we come here as lawmakers, but our people don't see us as lawmakers. They see us as agents for development. So I do not think that it is right for him to now bring up the second matter. The issue he raised was that he's an architect. And as an architect, there is a certain essential qualification to designate a facility as a 150-bed facility or 60-bed facility. So he wanted to put that on.
Minority Leader, yes. Are we really agents for development?
I said our people see us as such. And practically that's the work we do. We pay school fees. We are required to build hospitals. We are required to aid in the construction of roads. So our actions and statements should not confirm the fact that we are agents of development. I'm saying that we are not. We are seen as agents of development. Although our constitutional mandate is to enact laws. But we are seen as agents of development. Therefore, we take up that extra role. Mr. Speaker, when we are campaigning, do we even talk about lawmaking? When we are campaigning, we don't tell the people I'm going to make laws for you. We tell them that we'll bring development to you. That is what we tell the people. It's a fact.
Thank you very much, Honorable Minister. You may wind up.
Thank you, Mr. Speaker. Mr. Speaker, let me use this opportunity to thank my colleagues for their various contributions. Mr. Speaker, as I thank them for the contributions they have made, let me put on record that a lot of misinformation has gone into the Hansard, and I need to correct same. Mr. Speaker, we in the Ministry of Health have not revoked any health workers' appointment. Mr. Speaker, and they are part of the ministry, please. They fall under the Ministry of Health. So we, in the Ministry of Health,
Honorable Minister, please address the chair.
Very well, Mr. Speaker. Mr. Speaker, whether Ghana Health Service or any agency under the Health Ministry have not revoked anybody's appointment. Mr. Speaker, I therefore put it on record that any health professional who has gone through the right processes, who is covered by the clearance, which ended on 31st December 2024, and has been posted, would never be sacked. And this is a house of record. Mr. Speaker, I was exceedingly surprised when my own good friend, the minority leader, was trying hard to link the cholera outbreak with change of government. For his information, Mr. Speaker, we started recording cases in cholera as far back in October 2024. Mr. Speaker, yes, that is the records. If you don't know, please keep quiet. That is the records. Mr. Speaker, in 2024, Mr. Speaker, in 2024, in October, DCEs and MCEs were at post. But we recorded cases. And so let us not try to politicize the disease. Mr. Speaker, again, Mr. Speaker, Mr. Speaker, he also made...
Honorable members, can we have some order?
Mr. Speaker, he also sought to clarify whether or why a FUTU has delayed in the vaccination. Mr. Speaker, the practice is that we have a certain threshold that if you get there, we then put in the request for vaccination. Although a FUTU has recorded, cases in the recent times, they go there very late. And so as and when you get there, then we put in the application. We cannot use vaccination for one area for other areas. And therefore, I can assure you that by the end of next week, we may get consignment for a FUTU. Mr. Speaker, Mr. Speaker, based on the deliberations on the floor of the House, we have all agreed that cholera is sanitation and water problems, and we all need to come on board to fight against any kind of outbreak in this country. I thank you for the opportunity.
Of meningitis and cholera. So, Honorable Minister, thank you so much for coming to brief the House. Honorable members, statement time. Honorable members, we have admitted statements in the name of Duko Foriata, Honorable Member for Fantiakwa South, on sustainable funding for outbreak and pandemics. Honorable Member, you have the floor.
Mr. Speaker, thank you for the opportunity. This is my maiden statement in the House. The subject matter is sustainable funding for outbreaks and pandemics, which is becoming of a national disaster. Mr. Speaker, recently we have had the discussion on this floor about outbreaks and pandemics beginning in January 2025. With the
Second Deputy Speaker to take the chair.
With a specific reference to HMPV. The issue was first raised by our colleague, the Honourable Member for Suhum. Mr. Speaker, there is a next step or position that we as a nation must take to make sure our safety, protection, and safety of our people is a reality. Mr. Speaker, the Ghana Health Service, along with the National Vaccine Institute, earlier last year and into this year, gave us assurances on the state of affairs of outbreaks and pandemics in Ghana. They have been very vigilant in doing this. In their lingua, they assured us that no unusual pathogen were in any reports from the screening schedules across the 16 regions. We are grateful for their work. Mr. Speaker, the Minister for Health in the House today has reported one case of HMPV in Ghana. Mr. Speaker, the need to reassess our position as a nation on how we prepare for such matters, whether as an outbreak or a pandemic, is key. How prepared are we if there were an outbreak or pandemic of any other sort anywhere in the country? How prepared are we in research, human resource, appropriate facilities, adequate and appropriate vaccines, their supply, and most importantly, the financing? How prepared are we for education and awareness of the public? Mr. Speaker, the solution, therefore, must be in the front burner of this August House. We must support the initiative to be prepared to prevent outbreaks and pandemics and to protect the Ghanaian people at all times. To do so, we must have a funding stream for it. We must not wait till something happens, only then to scramble for financing with cap in hands as we do. Mr. Speaker, the solution is a dedicated fund to this cause, especially so in the absence of US aid funding, which was greatly beneficial to the health sector. The purpose of the new fund would be, 1, maintain financial support for disease and virus prevention activities by the Ghana Health Service, the National Vaccine Institute, and other related agencies. 2, ensure year-round preparation for prevention and combating outbreaks and pandemics identified by Ghana Health Service and its related agencies of this nature at all times. Mr. Speaker, I'd like to thank you for the opportunity. Thank you.
But you're not here yet.
Very well. Honourable members, our brother from Fantiakwa South, is it South? Yes, has raised a very fundamental issue regarding funding. So we are it is now time for comments on the statement. Yes, Honourable Member for Suhum.
Thank you, Mr. Speaker, and I rise to comment on the maker of the statement. I think that on the 21st of January, I raised a statement on HMPV, and I rise to support the statement that has been made by the Honourable Member for Fantiakwa South, that the state should have alternative source of funding to be able to curb some of these diseases. Thank you, Mr. Speaker.
Thank you very much. Yes. Yes, Honourable Member for.
Thank you, Mr. Speaker, for the opportunity to contribute to the statement ably made by my colleague on the Densi Health Fund. Mr. Speaker, one indication on how we are prepared to take up emergencies in this country is what my colleague is suggesting. The good thing is that we are aware that emergencies will always come, but we never know when the emergencies will come. And as a country, we do not have any source of funding to fall on other than the consolidated fund to deal with emergencies. The call for the setting up of an emergency fund hasn't started today. I do recall that there was an opportunity in this House when we suggested that the COVID levy the COVID levy that was placed on Ghanaians. We should think about an opportunity to change the COVID levy into a fund so that that would be used to finance emergencies in this country. That will be used to finance emergencies in this country. The call hasn't been heeded to. But I think that once a colleague has raised this matter again, I think that we have to go back to the drawing board and look at how we are going to set up a fund. Several of these have come up even in legislation. The other time I had the opportunity to comment on the setting up of a fund for the Mental Health Authority. That did not find expression. Again, we questioned the minister, the then Minister for Health, and he indicated that they were working the technicalities and then other details to see how they could establish the Mental Health Authority Fund. But as a fact, we will always deal with emergencies. And when emergencies come and we are not prepared for them, especially with funding and logistics, we'll be firefighting. And it's a good call. And I think that we should look at this thing dispassionately and think of setting up a fund to deal with health emergencies. Today, we are talking about meningitis as well as cholera. One of the challenges in fighting meningitis, particularly in my constituency, is that we have logistical constraints and funding constraints. We are aware that virtually every year around October, we'll have meningitis in the Upper West region. And my constituency is usually hardest hit. As I speak to you, in week 2 of the meningitis, my constituency, 5 people had died. Out of 30 cases, the case fatality was about 17%. But the District Health Authority did not have the adequate logistics to go around and do the education. We need logistics. And we usually wait until we are midway through the emergency and then we are pouring in logistics. But if we plan adequately, we know that by October, these emergencies will occur. The outbreaks will occur. And we deploy the logistics. They will need the lumbar puncture needles to be able to extract the samples to go for the testing, to understand that it is really meningitis we are fighting with. Medications. Even logistics such as fuel, and then for people to go around the communities and be able to educate the people on the emergencies and outbreaks, it's a challenge. So we are waiting and depending on the mainstream funding that goes to these health facilities and the authorities to be able to deal with this. So I think that's a good call, and I think that is something we should pay attention to. Such that in this country, beyond the statutory funds that we have a fund dedicated to fighting emergencies, because we know that health emergencies are with us and they will always come. Thank you very much for the opportunity.
Thank you very much. Yes, Honorable James Agaga.
Mr. Speaker, I thank you for the opportunity. I'd like to draw this House's attention to the existence of a fund, a disaster management fund established under the National Disaster Management Organization Act 2016. We have not paid particular attention to the existence of that particular fund, Mr. Speaker. In fact, when the COVID-19 pandemic broke, a special fund was created. Donations were received. I do recall that at the time, I made it known that it was unnecessary for that particular fund to have been established, because already in existence is a National Disaster Fund established under Section 38 of the NADMO Act 2016. And with your kind permission, Mr. Speaker, I would like to refer you to Section 38 of the said law. 37 as follows. There is established by this Act a National Disaster Management Fund. And then 38 talks about the objects of the fund. One,